I'm Dr. Michael Miyazaki, and today we're going to be talking about endodontic activation. Now, by using this little instrument called the EndoUltra, I feel like I can increase the predictability of my endodontic therapies, and I'm going to tell you why. One of the things that I notice is when I get into the canal of a tooth and I get my file, whether it be a hand file or one that's mechanical, I am creating a lot of debris. All the canal filings that file is creating creates adentinal mud, and that can get compacted down into the apical region of my root canal system, and I don't want that. What I want to do is I want to be able to get all that mud up. I want to get the walls cleaned out. I want to open up all those lateral canals. So we know that one of the best ways to dirty up a root canal system is by doing a root canal and using the files. We know that there are the main canals, and those are the ones that we take our files down and we do our main instrumentation with. But we also know that there's a lot of lateral anastomoses that connect everything together. And there's no way that we're ever going to be able to get our files into these little fins of connections. Those are areas that we just cannot get to with our instruments. So what have we done in the past? We've taken irrigants like sodium hypochlorite and we put those down and put that down into canal, and we've let that dissolve out our pulpal tissue and disinfect the canal system. But what I've always had a problem with is was I'm taking my irrigant and I'm placing the needle of my delivery syringe down into the canal. I'm always trying to be very careful that I don't express any sodium hypochlorite out the apical end of the root canal system. And then I put that liquid in there and I just let it sit. Maybe I'll take a file to agitate it. And I've always thought that that was a good thing to do. And think about this. If you are going home and you're going to wash your clothes, do you take all your clothes and throw them in the washing machine and let it fill up with maybe some soapy water and just sit there? Not really. We know that that's not going to get all the soap in between the fibers of our clothing to really get the debris, oils and everything like that out of our garment. So part of this irrigation protocol has been using sodium hypochlorite to dissolve the tissue and disinfect the root canal system. And then we follow that up with EDTA, and that's to remove our smear layer. And in our other videos, we've discussed this. But now if I just have that solution seeing the canal, it's not being as effective or optimally as effective as it could be. What we need to do is we need to agitate that. Now when I agitate that, now we know when we're going back to the clothes analogy, is now I'm getting the soap or the detergent in between all the fibers of our clothes. We are actually getting good cleaning now. And so if I'm using sodium hypochlorite or I'm using EDTA, what I'd like to do is I would like to get that in between all those little lateral canals. So let's go back to it. Sodium hypochlorite, we know that is to dissolve the tissue and disinfect. Then once I get that tissue dissolved out, I've got that dentinal mud on the canal walls, but I want to open up the lateral canal tubules. So I use the EDTA. Now EDTA, especially with our bioceramic sealers that can actually adhere to the canal walls, is kind of like our phosphoric acid etchant when we're bonding in a composite restoration onto a tooth. Before we bond that restoration into a tooth, we use our phosphoric acid. It removes the smear layer, opens up the dentinal tubules, then we apply our adhesive and our composite to the top of that, and we cure everything together. When we're doing a root canal and I'm using a bioceramic sealer, what I want to do is I want to use a sodium hypochlorite to dissolve the tissue and disinfect, but then I want to use EDTA to open up the lateral canal walls and the anastomoses, removing that smear layer. Now what makes these even more effective is our endodontic activation. That is when we take our EndoUltra. And here I'm taking the EndoUltra, and I know it's kind of hard to see, but when I put the tip of the EndoUltra and it activates the solution, it is like that washing machine, but at an ultrasonic speed, it is activating our solutions it is mixing everything up, and it is opening and allowing our sodium hypochlorite to better mix with the pulpal remnants in the canal to dissolve everything away, disinfect. And then we've got the dental mud in those lateral tubules, so I use the EDTA again with the EndoUltra, and that opens up those lateral tubules and canals. And then we go back in with the sodium hypochlorite, because now that mud's been removed, and it's kind of like putting your adhesive onto that acid-treated dental surface. Now the dental tubules are opened up, our adhesive can now get in. Now we know that if we have a smear layer and I put my adhesive on that smear layer, it may inhibit the ability of my adhesive to get down into the dental tubules, that smear layer, right? So I remove the smear layer, I go back in and activate my sodium hypochlorite to get into those lateral canals. And that is the best I believe we can do. And the research pans this out. So here's a sonic activation unit put into a solution. This is like sparkling water. And you can see how it takes that liquid and the little bubbles are formed there, and how we're getting activation of that. Now imagine that's in a canal, and I've got my sodium hypochlorite in that canal, and instead of that just sitting there, now we're activating it, we're mixing it up, we're taking our detergent, and we've got our washing machine working to actually mix everything up. Now what they found out with the sonic activation was it dissolved the tissues 12 times faster compared to when there's no agitation of the irrigant. So now when we throw the EndoUltra in there, the EndoUltra has ultrasonic activation, we're going to get an even better result. So the EndoUltra, again, it's a very small, easy to use, cordless little piece of equipment with a really fine tip that I put down into the canal. It promotes penetration of the irrigants into the dental tubules and the canal complexities, disrupts the biofilm and removes the vapor lock that we may get at the apical area of our root. And so we get less bacteria, we get better root sealing, and it is very easily incorporated into your standard irrigation. So if you're using sodium hypochlorite, once you get that canal filed out to maybe a number 25 file or larger, then now we leave a little irrigant solution in the canal and we activate it for about 10 seconds. We can suction that out, we can put more irrigant in there, and we can activate it for another 10 seconds. Then when we get to the part of the procedure where we use the EDTA, same thing, put some EDTA in the canal, activate it for 10 seconds. You may do that once or twice, or maybe in between the use of your files. Then go back with the sodium hypochlorite and activate that again at the very end, and then rinse that out. So it's very easy. So the effectiveness of the irrigation depends on the stream action and the chemical ability of the irrigants to dissolve the tissue. With syringes, the stream action is relatively weak, right? We're just kind of syringing in very carefully because we don't want to extrude it past the apex. And of course, this really depends both on the root canal anatomy and the depth that we're able to get the irrigating needle down into that canal system. But what's been shown is the irrigants can only progress maybe 1 millimeter beyond the tip of the needle. An increased volume of our irrigant doesn't really help the cleaning action. The only effective way of cleaning the canal system is by moving that irrigant solution, as the network of the side canals cannot be cleaned mechanically. We talked about that. We can't get our files into all those lateral anastomoses. In comparison to sonic irrigation, the ultrasonic irrigation has proved to be more powerful and able to eliminate more debris. So it is more efficient at activating our irrigating solution. So ultrasonics are a useful complement to cleaning the difficult anatomic areas where our files cannot get to. And it's effective in cleaning the root canal system associated with the irrigants when ultrasonic vibration is used and moves that irrigant in the canal system and along the walls. So again, we've got the same kind of solution. It is a carbonated liquid. But now we're going to take the EndoUltra into it, and you'll see there's like this explosion of bubbles Not just a few bubbles as we saw before with the sonic activation, but we're seeing an explosion of bubbles with this ultrasonic activation. So what does it look like clinically? Well, here is a lateral view of a root canal system. Here is a die in that system, and the EndoUltra tip, you can see it's going up and down, and that activation or that ultrasonic energy is pushing the die into the lateral anastomoses between these two main canals. And so again, that's what we want. We cannot get a file into this area, but if we were just to clean out the main canal areas and then seal that up, there would still be tissue left where these lateral anastomoses are. So what this is showing is by using the EndoUltra, we're able to actively push this die into these lateral spaces. So imagine that is your sodium hypochlorite. Well, now we are getting sodium hypochlorite into these lateral spaces to dissolve that tissue, to disinfect that area, should there be bacteria in that area. And then we take our sealer, and our sealer is going to get into these areas also. And that's why I think today we see a lot more of our post-op films from our root canals where there's lateral canals that have been cleaned out, and our bioceramic sealers are able to get into those canals. So the literature basically shows that with the ultrasonic activation, we get improved elimination of bacteria, and we have less smear layer throughout the canal system. Bottom line is a higher success rate for endodontic treatment. And that's what we're all about. We don't want our patients to experience post-op sensitivity. We want them to heal up and forget about the root canal procedure. It's just almost like a filling. So just showing that with sonic activation, the red area is the unclean canal areas, and the blue is the clean. So with ultrasonics, we see much more blue because using that energy, we're able to clean the canal systems out much more efficiently than just with sonic. But sonic is better than no activation at all. Here's as if you're looking down the root from the occlusal standpoint. So here's two main canals with a little connection in between. So with passive irrigation, that is when we take our little syringe and we unload our irrigant down into the canals, and it just let it kind of soak into the root canal system. We don't clean out very much at all, right? This green is tissue and bacteria that's left in between the mesiolingual canal and the mesiobuccal canal in that little isthmus. Now, if we do ultrasonic activation, you can see we clean out 99.8% of that isthmus, whereas up here it was only 27%. So this is just an example of how this activation really cleans the canals out much better. Again, the EndoUltra, very easy to add into your protocol. And when you're doing your next root canal, just imagine if you're just dropping your irrigant down into the canal with a little syringe and the needle going down there, and you're being very careful not to extrude any past the apex, how much are you getting out into the lateral canals? How much are you really, even in that main canal, using the effectiveness of your sodium hypochlorite or your EDTA? Again, imagine that clothes washer where you just have your clothes in there and it's just soapy water, but there's no activation. Now we get our washing machine going, it's agitating our clothes. That's what the EndoUltra is doing with its ultrasonic energy. It's mixing up the sodium hypochlorite or the EDTA within that canal system. It's pushing it out laterally, and now we have the maximum effectiveness. So again, something very simple to use, and I believe that this increases the success of my endodontic treatments. EndoUltra, give it a try. And if you enjoyed looking at this video, go check out our other ones and hit subscribe. We'll try to bring you more tips. We are a community of like-minded colleagues. We're trying to do the best for our patients. At Vista Apex, they're designing more materials and pieces of small equipment to make our job easier and more effective. So let's keep in touch, and I'll see you during the next video. Thank you very much.